yet another episode of As a Matter of Fact. Today we'll be looking at Nigeria's health sector. But before we start, I would kindly subscribe to our YouTube channel, share it with your friends, like this video, and leave your comments below. We would love to hear from you. We really would love to hear from you. Please do that. Subscribe. Thank you. You may be familiar with the idiom that says, health is wealth. It simply means that being healthy is better than being rich, or being healthy is more valuable than being rich. It is important that we place a huge emphasis on our health. In fact, the United Nations declares access to good health as a fundamental human right. In the Universal Declaration of Human Rights, under Article 25, it states that 1. Everyone has a right to the standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or lack of livelihood in the circumstances beyond his control. 2. Motherhood and childhood are entitled to special care and assistance, whether born in or out of wedlock, shall enjoy the same social protection. Let us go back to the last phrase of the first part of the previous article. Circumstances beyond his control. A perfect example of a circumstance beyond our control is the current COVID-19 pandemic. This means that you should be able to have access to good medical care and necessary social services. The question is, do you have access to all of these in your respective countries? Please comment below and let us know what the situation is in your country. Does your government currently give you access to good medical care and necessary services in this pandemic? Let us know in the comments below. On the African continent, access to healthcare is still a mirage for most of its inhabitants. According to the Stanford Graduate School of Business, fewer than 50% of Africans have access to modern health facilities. Many African countries spend less than 10% of their GDP on healthcare. The United Nations asserts that every year, lack of access to basic healthcare, mostly caused by poor funding, contributes to millions of deaths, untold suffering, and harrowing health tragedies on the continent. It further says that Africa carries 25% of the world's disease burden, but its share of global health expenditure is less than 1%. Worse still, it manufactures only a fraction less than 2% of the medicines consumed on the continent. Now, with all of these heartbreaking statistics, you would expect African presidents and governments to take our health systems, more seriously, because remember, health is wealth. Unfortunately, in reality, the opposite has been the case. Many African presidents and political officials travel to Europe, North America, and most recently Asia for medical treatments. This is called medical tourism. This situation is pathetic because the countries that these presidents and political officials go to saw the need to invest in their healthcare systems that make them attractive. That is why our politicians go there. According to The Conversation, an independent and non-profit media outfit, I quote, in 2016, Africans spent over $6 billion on outbound treatment. Nigeria is a major contributor. Its citizens spend over $1 billion annually on what is known as medical tourism. I do not know which is worse. Africans spending $6 billion on medical tourism, or Nigeria contributing more than 1/6 of the entire amount spent every year. Africa has a population of about 1.3 billion people, and more than 38% of its population, that is 512 million people, live in extreme poverty according to the World Poverty Clock. Remember, sometime in 2018, Nigeria overtook India for the inglorious prize of the world's poverty capital, despite having a population 7 times less than that of India. In fact, according to the World Poverty Clock, while Nigeria has a population of about 205 million people, more than 50% of its population, that is about 103 million people, live in extreme poverty. They live below $1.90 per day. How come a country like Nigeria, where more than half of its population are extremely poor, spends more than $1 billion seeking medical care abroad? Well, I think that most of the people spending this amount of money on medical tourism are the politicians. According to a research done by Epundu, Adema, Obona, and Epundu published in 2017, medical tourism has some of the following effects. 1. It reduces revenue for the country's local healthcare services. 2. It reduces the pressure to invest in certain beneficial health technologies, as well as political support for developing the health systems of the country. 3. Results in health worker migration to climes that are more favorable. 4. It leads to loss of health manpower, which worsens the health services of the country. 5, but not the least, leads to a loss of the funds used in training health workers, and the list goes on. Now, with all of these negative effects on medical tourism in Nigeria, you would expect that the government would make positive strides to end this practice. In fact, the government does not keep to its own law on improving the healthcare sector. The Epundu et al. Study also reports that the government spent 5% of its GDP in 2012 on the health sector, which is different from the Abuja Declaration of 15% recommendation. In the build-up to the 2015 general elections in Nigeria, one of the presidential candidates, Muhammadu Buhari, promised to ban all government officials from seeking healthcare abroad. This was reported by both the Vanguard and the cable newspapers. Now, I believe that this promise, including many others, contributed to why Nigerians voted for him in 2015. When he was sworn in as a president, Nigerians were certain that at last medical tourism would be a thing of the past, and our health sector would be as good as the ones we have in Europe, North America, and Asia. But in 2 years, President Muhammadu Buhari broke former President Umaru Musa Yar'Adwa's record of spending the most number of days outside of Nigeria seeking medical attention. According to the International Center for Investigative Reporting, as at the 8th of May 2018, President Buhari has spent 172 days in London hospitals for medical attention in 2 years, beating former President Yar'Adwa's record of 109 days in 2.5 years. The Punch newspapers reported that, I quote, between 2015 to 2019, Buhari has spent at least 217 days in the United Kingdom, mostly on health grounds, end of quote. Simply put, the government does not take healthcare seriously. At a TEDx talk hosted in Yaba, Lagos State, Dr. Ola Brown said this. Take a listen.
And here we have the spending per citizen. So in Norway, they spend about $6,000 per citizen. So that's the budgeted amount for every single citizen in Norway. They have an allocation of about $6,000 for healthcare. In the UK, there's about $3,000 for healthcare. In Nigeria, we budget about $6 per person for healthcare.
Think about that. Now, having failed woefully in delivering the promises he made for the health sector, as well as many other promises in his first term from 2015 to 2019, President Buhari continued to make the same promises when he sought for re-election in 2019. Here is an excerpt of the interview between Al-Jazeera and Festus Keyamo, the president's spokesperson at that time and the current Minister of State for Niger Delta Affairs. Take a listen.
Let me ask Festus this question. Over 2 years ago, just over 2 years ago, Festus, President Buhari said his government would, quote, not encourage expending Nigerian hard-earned resources on any government official seeking medical care abroad. And yet he himself, the president, has been receiving treatment abroad for almost 2 years for an unknown illness that he refuses to discuss. Isn't that hypocritical on the president's part, Festus?
It takes time to rebuild all the damaged infrastructure that they left behind. They left a health system behind that had absolutely nothing to rely upon. You see, it would have been different if we are talking about some other set of people that have never ruled before, that are making all of this, high-sounding, noise and words. These are the people Nigerians saw for 16 years. There was no health facilities. Our hospitals virtually collapsed.
So should he apologize for having said that he wouldn't send government officials abroad for medical care and then going abroad himself at taxpayers' expense for medical care abroad?
He never gave a time frame for that. I can't even remember the particular time he made that particular statement. But you have to rebuild infrastructure before you do that. In matters of health, you have to rebuild infrastructure. Because health is number one. And you don't expect people to die, not only him, any other person at all, in a state of health that may be terminal. You may have to seek help elsewhere until we rebuild what they damaged before they left.
Okay, let me ask you this. What did he go abroad to get help with?
Well, I'm not his doctor. I can't sit down here and give you his medical records. I'm not his doctor.
Why is it a secret for the president of Nigeria to not share his health? Most leaders tell the public if they have a health problem. Why has he got a secret illness that he won't talk about?
Because there's no political template and booklet anywhere in the world that tells you that he must share it. There's no political template or booklet anywhere in the world that says you must do so.
In a democracy, the people have a right to know, don't they, if their president is healthy, not healthy, if he's going abroad to get treatment at taxpayers' expense? What's it for?
I'm not his medical doctor.
No, but you're his spokesman and you want him to be re-elected for several more years. Don't the people have a right to know before they vote for him again if he's healthy or not and whether he can even serve another term in office?
When he tells you he's fit, but I'm not his medical doctor.
Well, by definition, he's not fit, is he, if he's going abroad for 2 years running?
I'm not his medical doctor. I'm saying he's looking very fit and healthy, and he has carried on his activities as president since he came back.
Okay, in the video, Mr. Keyamo claims that, I quote, it takes time to rebuild all the damaged infrastructure that was left behind, end of quote. Meanwhile, the Buhari administration has spent over 11 billion naira, almost 30 million US dollars, on the presidential hospital in 5 years, while China has built 2 coronavirus hospitals in just over a week. You may say, oh, that's China, the world's second largest economy. Sure, that brings me to my next point. Nigeria has all it takes to have a well-functioning healthcare system. The problems affecting our healthcare system have always been political corruption and the lack of a political will. The Chinese had the political will to build 2 hospitals in 10 days to tackle the current pandemic in their country, and yet the Nigerian government could not build any in 5 years. According to the Global Health Workforce Alliance, I quote, Nigeria has one of the largest stocks of human resources for health, end of quote. We do have a huge war chest of medical personnel, but the war chest is gradually depleting. For example, according to Devex, an international media platform, I quote, each week, at least 12 Nigerian doctors are employed in the United Kingdom, end of quote. Nigeria Healthcare Watch also reports that there are about 5,000 Nigerian medical doctors currently practicing in the United States alone. The Mail and Guardian reports that there are about 5,000 Nigerian medical doctors in South Africa and about 7,500 in the United Kingdom. Take note that these reports did not consider other medical personnel like nurses and medical lab technicians. If other medical personnel were added to those numbers, the numbers would have been highly unimaginable. But you may ask, how do we fix Nigeria's healthcare system? Now, here are my suggestions. 1. Focus more on our primary health centers. Granted that most of the mortalities in Nigeria happen in the rural areas, and also many people visit our primary health centers because they are far cheaper and more easily accessible. So equipping these centers will go a long way to improving access to health services in the country. Most people should be able to get healthcare needs quite cheaply and efficiently in their communities. Number 2, cut the cost of governance and reinvest the money elsewhere. How can a country that's the poverty capital of the world have more than 10 presidential jets lying waste in Abuja while our politicians live ostentatious lifestyles? In fact, from 2011 to 2020, Nigeria has budgeted over 73 billion naira, which is about $200 million US, for the presidential air fleet. Our politicians have dozens of aides and personal assistants. What for? Number 3, a law should be enacted that no political office holder, whether elected or appointed, should travel abroad for any medical reason. If caught, that person should face a 14-year jail term. That way, our politicians will channel their efforts to ensuring that our healthcare system is functioning, because they will also make use of it. Ask yourself this question: has any foreign government official traveled to Nigeria for medical reasons? Number 4, every government official should make use of the health systems in their constituencies. For example, senators should make use of the hospitals in their senatorial districts. Governors should make use of the hospitals in their states. And the president should use the hospital in the presidential villa. Flying sick government officials to Lagos for medical attention should stop. Everyone should be able to get effective healthcare in their states. And the last but not the least, this one is for the followers. Demand for accountability from your elected officials. Call them. Find out from them how much they've spent to improve the healthcare system in your community. And they should show you the evidence. Ask them what plans they have for your community's healthcare system. Ask them where they go to for medical treatments. It is important for you to know where they go to, because in May 2015, the then governor of Akwa Ibom State, Godspower, who is the current minister of Niger Delta Affairs.
So it is important that people who have gone to court, people who genuinely did jobs, should be paid for their jobs. So for me, I'm not against it, because of course, who are even the greatest beneficiaries? It's you people now. Okay. Because if you look at your chairman, gave... Okay, Honorable Minister. Honorable Minister, that's okay.
Yes, him. Commissioned the so-called world-class hospital in Uyo. He said this, and I quote, "We lose billions of dollars every year to medical trips abroad. We need a hospital that runs at international standard. We also decided to have a hospital that would answer to the needs of Nigerians in terms of advanced health management. That was why we built the Akwa Ibom Specialist Hospital," end of quote. Now, Premium Times reported that he claimed to have spent 30 billion naira which is about 80 million US dollars, to build a hospital. However, in September 2015, less than 4 months after commissioning the hospital, he was involved in a car crash. Now, here's the interesting part of the story. Instead of going to the 30 billion hospital that he commissioned a few months ago, he was flown abroad for treatment. Again, it is important that you know where your government representatives get their medical attention. Young people, young Nigerian, young African, understand that you deserve to live your life to the fullest of your God-given potential. Do not allow these politicians to mortgage your future and destiny. You have a lot to achieve, but first, you need to hold your politicians accountable. Stop singing the praises of corrupt politicians. They travel abroad to seek medical attention and send their children abroad for studies. You deserve to have the same experience as the children of the politicians. I am doing my best to make Nigeria and indeed Africa a much better place. As a matter of fact, I'm counting on you. Hey, if you enjoyed this episode, of course I'm sure you did, smash the subscribe button, share it with your friends, and even with your enemies. Like and drop your comments below. Let's have a conversation. As a matter of fact, I'm counting on you.